It is time now for Morning Rounds, this week with the husband and wife medical team. CBS News contributor Dr. Narula and plastic surgeon Dr. David Cangello. First up, a new investigation may have you rethinking some of your vitamins. Consumer Reports find certain ingredients in dietary supplements sold around the country can carry major health risks. Here's Tara with more.
43-year-old tattoo artist Bobby Cimarelli and his wife Margaret have struggled to get pregnant. Cimarelli decided to try over-the-counter testosterone supplements.
I was really bloated. My blood pressure was really high.
Within weeks, Cimarelli wound up in the emergency room. Doctors said the supplements were the likely culprit.
I had no idea that there were side effects. I thought it was just like regular vitamins.
Cimarelli is one of the roughly 200 million Americans taking dietary supplements. Consumer Reports identified 15 commonly used supplement ingredients that could be potentially harmful. Some examples: red yeast rice to lower cholesterol may cause kidney and liver problems. Green tea extract powder for weight loss may elevate blood pressure and cause liver damage. And kava to reduce anxiety may exacerbate depression. One area of concern is supplements do not undergo the rigorous regulatory scrutiny applied to prescription drugs and other over-the-counter medicines. Dr. Peter Cohen of Harvard Medical School.
The problem is supplements look just like these drugs on store shelves, but the requirements to get a supplement on store shelves is nothing compared to what it takes to sell aspirin or Tylenol.
What do you tell your patients when
Dr. Aida Vega is an internist at Mount Sinai Hospital. She says that doctors and patients often don't discuss supplements, which can lead to problems.
How important is it for physicians to ask patients about supplement use?
The most important part of this is to understand why they're taking it, because many times if you understand why they're taking it, you can steer them in the proper direction.
I wouldn't have even thought to ask about supplements because in my head they all seem so natural and so healthy.
That's right, Vanita, but it's so important, and patients think exactly what you did, which is that if it's natural, it's safe. But there are real risks associated with these products with a lack of proven effectiveness for most of them. Many of these products land patients in the emergency room, up to 28,000 visits a year from supplements. Patients can have serious organ damage and even have deaths resulting from this. And the problem is because of the lax regulation, you have no idea if your product is contaminated with bacteria or heavy metals, if it's mislabeled, if there are other ingredients in there, other prescription drugs or illegal drugs, and how those supplements are going to interact with your own prescription medication. So a lot of issues around this.
All right, next up, there are new concerns about medical tourism. The CDC estimates up to 750,000 U.S. citizens travel abroad for medical care each year. The most common procedures include cosmetic surgery, dentistry, and heart surgery. But a recent report warns about another danger regarding the growing practice. David, what's the new risk?
Well, the CDC recently talked about an outbreak of mycobacterial infections in patients who had cosmetic surgery in the Dominican Republic. They essentially looked at, or they discovered 21 cases across the United States, and 6 states were involved. Now, what we're talking about with these infections is that, they're infections of the skin and soft tissue of the surgical site. They can be very painful. They can cause abscess formation. And the real issue is that to treat these things, patients often require further surgery. They require antibiotics and sometimes prolonged usage of antibiotics because a lot of these bugs are resistant to treatment. So what's really important for patients to understand is that when you have surgery in another country, the standards for sterility and upkeep of medical facilities and surgical equipment is not the same. So you really are putting yourself at risk by having surgery abroad.
It seems like the price tag is the lure. So often when you hear from people who say they did something overseas, they say, I just paid so much less. Mm-hmm. I mean, I would imagine there's also additional pitfalls involved in that choice.
That is true. And, the pitfalls involved regard things like communication between the doctor and the patient. Mm-hmm. If you have surgery in a country where you don't speak the same language, the patient and the surgeon potentially don't communicate very well. And if they're not on the same page, there's the potential for poor outcomes or unexpected outcomes for the patient. Other issues involved are medical standards are not the same in other countries. So, for example, a doctor may use a needle on one patient and then carry it to another patient. The other thing is medicines. For example, are not regulated in the same way. So it's very possible that you use a medicine that's just completely ineffective. And the last thing that people sort of have to really worry about is when you do travel long distances, if you travel too close to your surgery date, you are at increased risk for blood clots in the legs, and that can be fatal.
So Tara, if you're considering having surgery in a foreign country, what do you do to minimize the risks?
Reconsider. But if you are going to do it, do your homework, do your research. So make sure that the facility or the doctor you're using is credentialed or certified. And certainly choose a doctor in your specialty or the field that you're looking to have a procedure done. So don't go to a gynecologist for a facelift, for example. You also want to figure out what is your follow-up care plan going to be. So who's going to take care of me when I come back to the States, take my stitches out? What if there's a complication? You want to find out what can you do after surgery. Can I drink alcohol? Can I sunbathe? Go swimming? A lot of these issues around communication, as David mentioned, are important. So you want to make sure that you bring someone with you, or you know how you're going to communicate when you're down there, and what potential legal recourse you might have if there is a problem.
All right, finally from us this morning, it's one of the most popular non-surgical cosmetic procedures, facial rejuvenation with fillers. More than 2 million filler procedures took place last year, a 6% increase from 2014. But for many patients, there is one fear: looking fake or plastic after the treatment. It's the duck lips. I feel like you see so many women with these crazy duck lips. What changes that makes the face look so different?
So duck lips are definitely an issue, but really, you know, the bigger issue sort of occurs when we lose volume in our mid-face. So our cheeks tend to flatten, we develop hollows around our eyes. So what we try and do is we try and replenish that volume by using fillers. The issue is if you use too much filler, you end up distorting facial proportions. So the cheeks become really puffy, the lower eyelids sort of push up, and that makes the aperture, the opening of the eye, look smaller than it normally is. So what's really important for patients who are looking to have these procedures done is they need to find somebody who's board certified. A board certified plastic surgeon is sort of the safest person to do the procedure. And in addition, you have to really sort of make sure that you're going to somebody that really understands the artistry of facial aesthetics, and that can be a hard thing to find.
All right, Drs. Tara Narula and Dr. David Cangello, also known as the most beautiful and accomplished couple. Thank you both so much for joining us.
Thank you.